Hello, and thank you for joining my presentation on Project M4, Mississippi Mothers Mitigating Mortality. To begin, I would like to give you a little background about what has inspired this public health initiative. Today, Mississippi is the least healthy state with an infant mortality rate of 8.7 deaths per 1,000 live births. Infant mortality is defined as the death of a baby before his or her first birthday. So what this essentially means is that for every 1,000 babies born in Mississippi, at least 9 of them never make it before their first birthday. For reference, in 2019, there were 36,636 live births in Mississippi. At this rate, the math represents way too many children lost to circumstances that could be changed. So why should we be concerned? Well, with the highest infant mortality rate in the nation, infant mortality is actually a very important indicator of the overall quality of health and healthcare of a population. So how did Mississippi get to where it is today? Well, research has shown that the leading cause of infant mortality in the state is preterm births, with 14.2% of infants were born preterm in 2018. This is 4.2% higher than the national average. Premature births is a very complex, multifaceted healthcare issue with no single solution. However, with Project M4, specific focus can be placed on an evidence-based determinant of preterm pregnancies, which we have found to be unintended pregnancies. What is Project M4 then? Project M4 is a public health intervention that intends to lower the state's infant mortality rate by mitigating unintended pregnancies among Mississippi women through centralization of resources and collaboration among services. While the project intends to serve all Mississippi women, Project M4 plans to target some specific communities that research has emphasized these communities to be disproportionately impacted as compared to their counterparts. Emphasis on these communities will play a large part in outreach services and resource distribution within Project M4. Like any other, this program will require resources and funding to be successful. But today, it is important for you to understand what your role as a stakeholder would be for Project M4 and how together we can tackle this healthcare issue. As mentioned, preterm pregnancy and infant mortality have been linked to unintended pregnancies. However, with the highest unintended pregnancy rate in the nation, there is minimal publicly available data that thoroughly explores the links other journals have found to be strong links between unintended pregnancy, preterm, and low-weight birth pregnancy, as well as infant mortality. Hopefully, with this infographic, the links will become clear and you can see the impact of this public health issue on Mississippi. To begin, let's just go over some of the facts. Unintended pregnancy as defined as a pregnancy that is either unwanted, unplanned, or mistimed. An average of 44.6% of Mississippi women experience unintended pregnancy, which is nearly 15% more than the national average. As a major public health concern, negative outcomes have been linked to unintended pregnancy, which, as mentioned, are preterm birth, low birth weight, and infant mortality. A March of Dimes report put Mississippi in the spotlight as one of the 3 states graded the poorest in terms of preterm birth rates. The infant mortality rate was 10 times higher for preterm births compared to term births. Today, half of the infant deaths in 2018 were very low birth weights at less than 3.3 pounds, and 19% were low birth weight at less than 5.5 pounds. As you can see, there's a strong disproportion of unplanned pregnancies among women under 24, non-Hispanic Black women, women of low income, those without high school education, and unmarried women. Even looking across Mississippi counties, you can see there are specific parts of the state specifically struggling with infant mortality rates. From what it looks like, at least 5 counties have infant mortality rates between 12.8 and 21.7, and another 10 counties have rates between 11.3 and 12.7. What do these counties' unintended pregnancy rates look like? Well, with Project M4, this is the state's opportunity to finally get a grasp of those numbers and its impact on infant mortality. The consistency in accessibility, availability, and affordability of effective contraceptive methods is integral in preventing unintended pregnancies. Using methods of highly effective birth control, such as long-acting reversible contraception, or LARCs, reduces unintended pregnancy, but the use of these more effective methods has been low in Mississippi, particularly for low-income populations. Other states have successfully reduced the rates of unintended pregnancy by providing timely access to highly effective birth control methods through health system delivery improvements and provider and patient education. So, this is our plan for Project M4. This need for change is going to come from this project. Now that we've done the research and compared the data on unplanned pregnancy in Mississippi, and have seen how it can be linked to infant mortality and other negative health outcomes for both mother and child, we bring all of this to you today to communicate with all of you about your potential role in all of this. If you look around, you will see representatives from the local community to some federal stakeholders. This project's success is heavily dependent on how potential stakeholders are involved in Project M4. The Mississippi State Department of Health can continue to fund and support Healthy Mother, Healthy Baby, PHRMISS services through Project M4, as their case management services would be utilized by the communities Project M4 serves. Local hospitals can collaborate with Project M4 to centralize the low-cost childbirth and breastfeeding classes, like in the Jackson area maternity does, but spread these services across the entire state. By working with stakeholders such as PRAMS and the CDC, the data and information collected from Project M4's researchers can contribute to the annual reports the Mississippi State Department distributes every year. This means joint research projects can be conducted between federal and state stakeholders with Project M4 on unintended pregnancies in Mississippi. This is going to further the scientific community's evidence surrounding this issue, and while these are just a few examples of how our potential collaboration could be, let's just see specifically how you all can be part of Project M4. Think of Project M4 as a one-stop, has-all service with a specific focus on a public health issue that hasn't been given the appropriate amount of attention it seriously needs. With a combination of outreach initiatives, localization of resources, and centralization of unplanned pregnancy mitigation, stakeholders like you can provide this project the resources, services, and funding it needs to serve Mississippi women as a statewide initiative. With stakeholder involvement, Project M4's focus can be specifically on unplanned pregnancy among Mississippi women as it relates to infant mortality. It not only intends to lower the state's infant mortality rate, but also hopes to lessen the significant financial and social burden this critical challenge inflicts on the public health system. As a multifaceted, complex issue, unintended pregnancy requires a collaborative, multi-pronged solution. That solution can be Project M4. As I was doing my research, I noticed that there is a serious need for more research to be conducted on unintended pregnancy in Mississippi. The lack of access to public data sets that were current enough to support Project M4 were hard to come by, and it just made it more clear that unintended pregnancy among Mississippi is a serious issue and cause for public health concern. I do appreciate you listening today to Project M4, and I hope that you will be part of a bigger initiative to stop unintended pregnancy and lower Mississippi infant mortality rates. Here are my references, and if you have any questions, please feel free to reach out. Thanks.